Ever wish you could pop the hood on your own brain and see how fast the gears are turning? Like where they're humming and where a tune-up might help? I'm Dr. David Haase from the MaxWell Clinic. Soon, you'll be taking your upcoming CNS Vital Signs, which stands for Central Nervous System Vital Signs. It is a computerized neurocognitive test, and you'll either be taking it in the quiet of our testing room here at the clinic or from the comfort of your own home computer. This quick computer-based test lets us do exactly that. In the next few minutes, I'll show you how it reveals your memory, attention, processing speed, and all kinds of other important brain metrics. I want you to arrive or log in confident, well prepared, and ready to turn those 20 or 30 minutes into meaningful insights for your cognitive health. Because your brain is your most important organ. Your quality of life is dependent upon your brain. So we really want to know what's going on there. So again, what is CNS Vital Signs? It is a scientifically validated, computerized neurocognitive test. It's used in thousands of clinics across the world. It takes about 20 to 30 minutes to complete, and it automatically compares your results to age-matched norms across 11 core brain functions. Think of it as a fitness test for your brain, revealing where you're strong, where you're average, and where you might need a little extra support. You're going to move through a series of quick tasks that measure these areas. First of all, memory. We'll test your verbal memory and visual recall. We'll assess your processing speed. Like, that's how quickly your brain takes in and responds to information. We're going to measure your executive function and cognitive flexibility. That's your ability to plan and switch tasks, solve problems, and stay with a particular course of action. We're going to measure your attention and your reaction time. The ability to sustain focus and rapidly respond accurately to the events in your world is incredibly important. So by the end, we get a multi-dimensional scorecard that tells us far more than any single memory quiz or crossword puzzle ever could. At MaxWell Clinic, we believe what gets measured gets improved. Your brain is the most important organ in the body, and the best way we can tell how it is functioning is to test its function. CNS Vital Signs gives us an objective baseline before beginning therapies such as neurofeedback, our habitat-optimizing plasma exchange, or ketamine-assisted therapy. It also helps us to track your progress over time, so you can literally see your brain getting fitter, faster, and more resilient. This test empowers us and you to personalize your care plan, target the right therapies, and celebrate your gains with hard data, not just gut feelings. Where you take the test depends upon our circumstances. We really prefer to run your CNS Vital Signs assessment right here in the clinic, where we can control the lighting, the noise level, and the equipment for the most reliable results. But we also recognize many patients travel in from out of town, across the country and around the world. So an at-home option is available, and we'll make that available to you. So in these two choices, if you're doing the test in the clinic, we'll seat you in a quiet testing room with a full-size keyboard and mouse and a trained team member ready to answer your questions. If you do this at home, we'll email you a secure link. We'll ask you to take the test on your laptop or your desktop, and those results will flow straight to us with the same accuracy, just added convenience. If you do this at home, make certain that you tell everybody in your home that this is what you're doing, that you turn off your phone, you turn off everything that could be a distractor in your environment, that you listen to the instructions very carefully, that you do the pre-test, because we have some practice tests built into it just to give you extra confidence, and make sure you follow those instructions, and this goes wonderfully. Now, here are my pro tips for getting top quality results. Choose a quiet, well-lit space. I already told you to turn off your phone, but I'd prefer that if you can't turn it off, at least silence it. Turn off your notifications and let everybody know you're going to be unavailable for about a half an hour. Use a laptop or a desktop with a really stable internet connection and a full-size keyboard. Tablets or phones can slow the reaction time score, so we don't want you to use those. We want you to sit comfortably with both your keyboard and your mouse in easy reach. And test when you're alert. Morning or early afternoon is ideal. Probably want you to skip it if you're profoundly sleep deprived or feeling unwell. Stay hydrated, but visit the restroom first so you won't need a break. There's additional instructions to avoid caffeine and some of your medications before you do this test, but talk to your clinician about exactly what the right testing conditions are for your particular biology so that we're truly measuring what matters. So what happens after the test? Your scores calculate instantly, and we'll upload the full report to our secure patient portal. Feel free to peek, but don't stress about interpreting every number. That's our job. At your next appointment, a clinician will walk you through each domain, highlight your strengths, flag any areas that might need support, and map out next steps together. Whether that's targeted brain training, nutritional tweaks, advanced therapies, or simply tracking your progress every 6 to 12 months, as you would with your blood pressure. We pay a lot of attention to the heart, but we should be looking at the vital signs of the brain just as often and as completely as we do your blood pressure. This test is designed to be tough. That's by design. It's there to test the limits of everybody that takes it. Most everybody feels like they did bad on this test. That's normal, okay? The truth is, the only way to do bad on the test is to either not try or to not take it at all. Because by the end, you'll have insights into your most important organ, and that's a major step to you getting to experience the fullness of your MaxWell. There's nothing to study for. Simply follow these quick guidelines, relax, let the assessment do its job. If any questions pop up, call or text us anytime at 615-370-0091, and we'll be happy to help. So proud of you for taking this step to quantify your health so that you may continue to improve your health. Take care.